There we go. All right, good evening, everyone. I'm ready to get started. I have a lot of slides that I want to share with you. We'll answer questions at the end. Nice to see you all on this beautiful Pittsburgh evening. Springtime is approaching. I'm Dr. Paul Lieber. I'm from Regenexx Pittsburgh. I'm one of the partners. I've been practicing physical medicine rehab for 33 years. I'm a physical medicine rehab doctor. I'm board certified in that specialty and also board certified in pain medicine. It's important to know that not only am I a Regenexx physician, but I'm a Regenexx recipient. I've received both stem cell treatment and platelet-rich plasma on multiple occasions, and it really has kept me going and enthusiastic about several sports, but mainly cycling. So we have Dr. Adelsheimer on the left, Dr. Sally on the right, and we now have 3 locations, our main location in RIDC Park in Pittsburgh, and locations in Bridgeville and Washington. So tonight I'm going to talk about regenerative myth busters. It's a way of getting this information across to you. The first thing is that Regenexx doesn't matter. And Regenexx is the #1 largest provider of orthobiologic treatment in the world. We have 75 affiliates in the United States and several in other countries around the world. The Chief Medical Officer, Chris Centeno, is the recognized authority in this specialty. And we, Regenexx, have provided more platelet-rich plasma and bone marrow concentrate stem cell treatments than anyone else in the world. So the interventional Regenexx is several things. We're a highly selective physician network with proprietary high-dose protocols. We're the world's leader in research and development, and we also have a national self-funded employer practice. The specialty we practice within is interventional orthopedics, less invasive new medical specialty. We deliver orthobiologics, that's your stem cells and platelet-rich plasma by injections. We don't use any scalpels or saws. And as such, there's a lower risk to this treatment. The next thing is the myth physicians don't matter. You can see that there are entities where physicians are not providing the initial evaluation, they're not delivering treatment, they're not making diagnoses, they're relying on chiropractors, nurse practitioners, physician's assistant, and there's a difference. We are physicians, we're specially trained in the field, and it makes a significant difference when you have a physician as opposed to a physician extender. And understand that we're all board certified specialists in this field. Next, education doesn't matter. It certainly does. In the Regenexx network, you have a better chance of going to Harvard Medical School than being an orthobiologic provider within the network. And it's important, again, the physicians that are part of the network are physical medicine rehab, interventional radiology, orthopedics, and family practitioners with sports medicine background. Here in Pittsburgh, we're master's level certified through the Interventional Orthobiologic Foundation, which is the educational arm of Regenexx. And we this is the highest level certification, and we've gone through every orthobiologic course that they've ever offered. We're out there training 3 to 4 times a year so that we get better and better at what we do. And everyone does treatment within the Regenexx network virtually the same. Next myth, diagnosis doesn't matter. It absolutely matters a great deal. And you want a physician to be able to perform the diagnosis and make the diagnosis of the problem that you're having. For instance, give you an example. You come in complaining of knee pain, but you tell me that your pain is also in your thigh and your calf down the front of your leg. Well, chances are you also have a pinched nerve coming from your spine in addition to a knee problem. So if you weren't trained in this specialty, you're going to miss the diagnosis at least a third of the time. And as a result, you're going to be doing the wrong treatment. Another myth, and this isn't a myth, in most practices, doctors never spend time with you. But at Regenexx, when we evaluate you, we're going to spend an hour with you. We're going to gather your history, do a physical examination, perform an ultrasound examination, review your diagnostic studies that you bring with us, and we're going to talk about the treatment, explain it to you from the beginning to end. Nowhere else do you get a physician who spends an hour with you, but we do, just making sure that you're getting the right treatment and that you're satisfied with the treatment that we're explaining to you. Next myth, experience doesn't matter. It absolutely, again, does matter. Regenexx was the first provider in the United States in 2005. We were the sixth provider for Regenexx in 2012. We've been doing this. We've performed over 3,000 bone marrow concentrate treatments. Read that as stem cell. And 12,000 platelet-rich plasma treatments. We've performed more treatments in Pittsburgh than all the other providers combined. Next myth, image guidance doesn't matter. What we've learned is that using an ultrasound on the bottom right and a fluoroscope, which is a fancy X-ray machine, to image guide or needles makes a huge difference. There's literature that suggests that if you just put a needle in the knee or a needle in the shoulder without guidance, you're not going to get a good outcome. But furthermore, we treat the joint, the ligaments, the tendons, the joint capsule in a concerted effort to improve your condition. And at times we'll go outside that treatment arena, treating nerves and other areas that may be involved and considered to be problematic. Next myth, orthobiologics don't matter. So at Regenexx, we use a lab inside our office as opposed to a bedside centrifuge. As a result, we can concentrate things to optimize your treatment. So for instance, joints, tendons, and ligaments require different concentrations of platelet-rich plasma. And so we can do that, and we can much more highly concentrate the platelet-rich plasma than can a bedside centrifuge. So if you're a young person, we're treating your anterior cruciate ligament, you may require a 7 to 10x a concentration of platelet-rich plasma, whereas if you're a 70-year-old fellow like I am, you may require 20x into the joint to make a difference, a higher concentration as you get older. So let's talk a little bit about platelet-rich plasma. We call it superconcentrated platelets. PRP has growth factors within it and other cells that amplify the healing process. Platelet-rich plasma tracks stem cells into the area. It's like an espresso shot for local repair. It makes all of these cells work harder and longer to heal tissue where we put the platelet-rich plasma. And stem cells work a little differently. They act as the general job. They tell other cells what to do. They work in conjunction with platelet-rich plasma, and they can become tendon cells, cartilage cells, bone cells, ligament cells, whatever we put them on with the image guidance, they can become. Another myth, my stem cells are too old. No, they're not. Over time, you have less stem cells, but they're just as good and viable as young stem cells. And what we found is that you have plenty of these cells available to treat you, treat at least one large joint, sometimes a large joint and a small joint. And you should know that embryonic placental cord blood and Wharton's jelly that used to be described as stem cells or tissue products, and the FDA has shut all these things, all these companies down. So if somebody says, I'm using cord blood, they're using tissue, and the FDA says that they're on illegal ground. My joints are too degenerated. No, we treat bone-on-bone osteoarthritis of numerous joints, but especially the knee joint, all the time. This is what we treat most of the time. People come to us wanting to know whether we can do anything for them rather than have their knee amputated and a joint replacement. And what we found is that these people do quite well. This is some folks get years and years, up to about 12 years of relief. So very similar to a joint replacement. And importantly, 87% of the people who were told that they needed a joint replacement didn't undergo it after undergoing the Regenexx stem cell treatment. The FDA doesn't weigh in on the matter. Yeah, they do. They consider what we do using bone marrow concentrate as the only FDA compliant treatment. We're using your cells, and therefore they can't be rejected or cause infection. Cells from fat are illegal and considered to be making a drug. So though there's plenty of research using stem cells from fat, it's still not legal as a commercial product. And which one is for you, whether it's platelet-rich plasma or bone marrow concentrate? Typically, we do about 80% PRP, 20% stem cell. The PRP by itself costs substantially less, and not everybody needs stem cells. PRP is for smaller joints, less severity, ligaments, tendon, and spine. Bone marrow concentrate stem cells for larger joints, more damage, more severity, and lesions in the bone itself, so non-healing bone fracture. Younger people get away more often with platelet-rich plasma treatment in their menisci and other areas. Research doesn't matter. Research makes a huge difference. And if you're not following research protocols, then you're really, no pun intended, doing a shot in the dark. Regenexx has completed 40% of the world's literature on stem cells. Our registry of patient outcomes contain about 35,000 patients at this point. You have to have science and consistency to know what works in order to make it better. And we attempt to make it better for our patients on a day-to-day basis. Orthopedic treatment is the only option. Here at Regenexx, we are the trusted alternative to orthopedic surgery. 80% of all orthopedic surgery has not been proven to be effective from literature outcomes, and some can even make it worse for you. Remember, our treatment is done with needles, not with scalpels and saws, and as such, it's considerably safer. So when we use your stem cells and your platelet-rich plasma, we're allowing your body to heal itself. A great example is the meniscal surgeries that have been performed in the past. 95% are unnecessary. And what they do is they change the biomechanics of the knee, creating a stress riser scenarios that speed up the onset of arthritis. So our motto is let's stop cutting stuff out and inject orthobiologics instead to help tissue heal. Next myth, regenerative treatments are limited. We have very little limitations other than we treat nothing but the musculoskeletal system itself. We can treat everything from the tip of the top of the spine to the big toe, all sorts of joints, all sorts of conditions like herniated discs, anterior cruciate ligament tears, rotator cuff tears, in addition to the arthritis that's commonplace as we get older. We treat more areas of the body better than any other network in the world, and certainly the entities that are in Pittsburgh. Another myth, one size fits all. It doesn't. We do an entirely individualized treatment plan to treat your needs and address your conditions. We at Regenexx Pittsburgh will offer you the best possible treatment option. Sometimes you can't undergo those options, for instance, if you have recent cancer, and so we'll offer you an alternative. Our on-site lab, our intellect, skill, and expertise enable us to dial the right dose and treatment for you on all occasions. Next myth, these treatments are not safe. We have the largest safety paper of 2,500 patients at Regenexx, and we found that the treatments are extremely safe. The most common complication is pain at the injection site that lasted for a few days. Here at Regenexx Pittsburgh, we have a 0 infection rate, and we think that guidance, fluoroscopy, ultrasound, and safety and care make a big difference. You'll be off work for a long period of time after this procedure. In many cases, people get back to work the following day, and as opposed to joint replacements where you're taking several months off work, you're getting back to work very, very quickly, and this saves you time and money. And also helps keep you happy and keeps the weight off. So all good things. I have too much wrong to be considered a good treatment candidate. You know, sometimes that is the case. If you're toppling over too much, like the Tower of Pisa or the knee on the middle of the page, we can't correct that problem for you, and you're better off getting a knee replacement. If you've had recent cancer, you're not a good candidate for stem cells, but we can still treat you with platelet-rich plasma. If you have what we call metabolic syndrome, where you're very sick, we don't think your stem cells are going to be particularly effective. But most of the time, we can treat you quite well. We don't treat the entire person, we just treat a body part. I've been talking about body parts, but we look up and down your structure, your articulation, your neuromuscular system, and look for symmetry. We treat the muscles, the tendons, the ligaments, the fascia, and the nerves. They're all interconnected. And if you don't think about nerves that are affecting your knee, or your Achilles tendon or your hamstring tendon, you've made a big mistake, because it's the nerves that help the quality of the tendons and the muscles along. And if you don't have good quality nerves, you've got a problem. That's just one example, but we really look at you as a whole person. Only young athletes can receive these treatments. Not true. We have young athletes and Ironman triathletes, but we rely on and treat people who are older, joggers, golfers. We treat folks who want to have their athletic activity, be walking or gardening. We want to make you happy and get you back to whatever you love. Taking bone marrow out of my pelvis is going to hurt. Well, it really doesn't hurt. And this is a video that shows that. A small drill bit is put in. You can see the ultrasound in front of Dr. Adelsheimer, who's doing the procedure. He's aiming at a particularly safe part of bone. You can see the woman's not flinching because she's been well anesthetized. We then take a skinny drill bit, and we're in. She didn't flinch. It really causes virtually no pain whatsoever. Drawing the bone marrow out can cause some deep ache that is mild, but otherwise it's a comfortable procedure to do. You won't be able to get back to your active lifestyle. That's what everybody's concerned about. Yeah, you will. Most of all treated patients are able to do so, whether you're running marathons or gardening. It doesn't matter. It does take time for healing to occur. Typically, pretty much full healing has occurred within 3 months. We get you involved in some physical therapy, and sometimes we'll provide a short period of bracing, but it's nothing like going through an orthopedic surgery. These treatments are way too expensive. So it's true that they're expensive, and insurance doesn't usually provide for the regenerative portion of treatment, but with copays and deductibles, you may actually wind up paying more besides the minimal time that you miss away from work compared to comparable orthopedic procedures will save you thousands of dollars in the long run. So the stem cell treatment, the first thing that we do is we are all farmers here. So we till the soil. We get the area that we're treating ready for stem cell treatment by stimulating inflammation to rally your body's immune response to the area. The heightened immune response prepares the site to take full advantage of the stem cell injection. We've talked about bone marrow concentrate. We get this from your posterior pelvis. We re-inject you about 2 hours after the bone marrow aspirate. The bone marrow aspirate typically takes about 20 minutes to do. And as you saw before, we don't use the trocars that are thick. We use a skinny drill bit, and it's virtually painless. And then we plant the stem cell seeds 2 to 4 days following the pre-injection. We take the bone marrow aspirate, take it to our lab, concentrate it, and get the nucleated stem cell layers out. We process it by centrifuging it, and then we re-inject it 2 hours later. And then last is fertilize the seeds 2 to 4 days after the stem cell injection. It involves a simple blood draw, again, concentrating your platelet-rich plasma and re-injecting in that area. So it's really, this is for most people who want to avoid surgery, keep all their body parts, don't have downtime or time for lengthy rehab. They don't want drugs. They've failed surgery before, know somebody who's had a bad outcome. They have medical contraindications for surgery, or they're too young for surgery. A good example would be a high school athlete who's torn their anterior cruciate ligament. They don't want to go through surgery. We can oftentimes heal that anterior cruciate ligament with an injection. So the results, good outcome, less pain, increased function, improved mood, you're off your pain medications, and you're back to your preferred and active lifestyle early. You get your life back, you get off your pain meds, you have fun. You're able to interact with your family again. You're able to earn money quicker. You get your fitness and back quicker. And when you're happier, your relationships with friends and family and loved ones go better. So the next step, there is no referral necessary. We want you to gather your imaging, your MRI or your x-rays, or both if you have them. If you don't, we can order them once we see you. Call the Regenexx liaison, go to the appointment or a telemedicine appointment, get the imaging. We'll prescribe the imaging if you haven't had it, and we'll tell you whether you're a candidate for treatment and what treatment you're a candidate for. You're going to rehab at home or have some physical therapy, and you're going to get back to the lifestyle that you enjoy. So again, make an appointment. We're all Pittsburgh. We're Pittsburghers. We're all specialists in physical medicine rehab. Two of us are board certified in, additionally in pain medicine, and Dr. Sally is board certified in sports medicine. We have the training. We're all master's level certified. That's the highest certification that is possible through the Interventional Orthobiologic Foundation. We've each taken about 20 courses out in Denver, training for what we do. And we're going to use imaging both in the evaluation appointment, but also imaging throughout all of the procedures that you're going to go through to get you better. You're going to get an exam. Again, it's an extended exam. We're not just going to focus on your knee. We're going to focus on your neurologic system, your symmetry. We're going to look up and down your body to see what's out of kilter. And you may need treatment in more than one area. We'll let you know. We're going to look at your imaging studies if you have them. If this is a peripheral joint, we're going to do an ultrasound examination, and we're going to answer all your questions during that appointment. Who does that? You have a doctor for an hour. Who does that? Who gets that? Finally, you're going to get treatment. There's little to no rehab. There's minimal to no pain meds associated with it. Again, I've had this treatment. I took 3 pain meds the first evening, and that was it. I didn't miss work. You get back to work right away. You get your life back sooner rather than later. So we do this quickly. From the standpoint of the recovery, though, again, full recovery can be around 3 months. So 4 reasons to take your health off hold today. 1, you avoid the surgery backlog and worsening of your condition. You get your fitness back. You get your weight down. You increase the quality of life with your loved ones. And remember, no one's getting any younger. So what today was a partial thickness rotator cuff tear, or not so much a leaning Tower of Pisa 6 months down the road, can knock you out of the possibility of having regenerative treatment if things get much worse. Insurance most often covers consultation, follow-ups, diagnostics, bracing, and therapy. Insurance doesn't cover regenerative procedures, prolotherapy, platelet-rich plasma, platelet lysate stem cells. Remember, with copays and deductibles, you may actually be paying more for traditional orthopedic surgery. Don't forget, you're going to be off work for a couple months, and that's income that's lost. Every treatment plan that we make is customized to you. Finally, we are the only network in the country and maybe in the world that has insurance coverage through self-insured employers. To date, we have 1,200 plus self-insured employers, an example being the entire city of Erie gets their employees covered with the Regenexx procedures. We have about 10 million covered lives. There are some places that are listed on the right. More recent folks are 7-Eleven and Under Armour. So contact Sarah Ferlin. You can get her through our main number, 412-963-6480. Schedule a new patient exam. We'll be happy to see you. Your insurance pays. You're not at risk. You haven't spent any money, and you're going to be better informed about your problem than if you go see an orthopedic surgeon. So come on in. We're happy to see you. We are enthusiastic about what it is that we do, and hopefully that enthusiasm will translate to you as well. So avoid surgery, reduce downtime, and get your life back. And that's it. So I'm going to try and answer questions now that you may have posed. And since no one, I must have done a great job because nobody has answered a question yet. We had some pre-question questions, so I'll answer them first and then give you time to think about the questions you may want to answer. Does your center perform PRP injections for shoulder arthritis? Yes, we do. Typically, that's for a mild and sometimes moderate arthritis. Usually, severe arthritis is we use bone marrow concentrate for stem cell treatment. The exception to that would be if you had active cancer, we would just perform platelet-rich plasma treatment in that area. If yes, does age and physical condition of the patient influence the prospective efficacy of the procedure? It does. It does and it doesn't. Age really doesn't matter in terms of the efficacy of treatment. Physical condition can matter if you have multiple systemic conditions that have you being sickly, then the treatment will be likely less effective. What imaging is required to assess candidacy of patients for PRP injections? We like to have X-rays and MRIs if at all possible, but and in the exam, as I said previously, we're going to use ultrasound to assess your injured and or degenerated area. And we'll show you exactly what you have, both in your imaging that you bring in and your ultrasound examination. You'll see exactly what's going on. Does your center have results of the efficacy of PRP injections, specifically for glenohumeral osteoarthritis, shoulder arthritis? So this was Richard. Richard, if you go into Regenexx, you can bring up by joint the efficacy of the osteoarthritis treatment. And I believe you can do that for specifically for Regenexx Pittsburgh, and you may be able to do it for the specific doctor that you're entertaining having treatment with. Typical duration of pain reduction. That varies based upon what we're treating. If we're using platelet-rich plasma, the duration can be anywhere from 1 to multiple years. If we're using bone marrow concentrate, we have literature on knees that says 2 to 12 to 15 years of efficacy in severely degenerated knees. So I'm going to take some of the questions now that are present, and then I'll go back to the written questions. How long will a hip stem cell treatment last? So the answer to that question is again, you have the possibility of the stem cell treatment lasting for above and beyond 5 years duration. And it may last longer than that. It can provide long-term relief. If you have mild osteoarthritis of the hip, and I do a platelet-rich plasma injection, it can last for up to 3 years, say, just with PRP. Next question. I have breast cancer and I'm going through immunotherapy. Am I still a candidate for treatment? You are a candidate, but you're not a candidate for stem cell treatment. You're a candidate for platelet-rich plasma treatment. Next treatment from James. How are torn ligaments and meniscal tears treated near the knee? So it depends upon how bad your knee is. If you have mild arthritis, we're going to put platelet-rich plasma into your knee. If you have a substantially torn anterior cruciate ligament, it's going to require stem cell treatment. So it depends upon the extent of ligamentous tears. It depends upon the extent of meniscal tears. So for small tears, typically PRP is enough. For severe tears, typically stem cells are enough. Next question. I've been told that I have bone-on-bone knee arthritis in both knees. The doctors were recommending knee replacement. Am I a candidate? Unless your knees are the Leaning Tower of Pisa, where they are either too knock-kneed or too bow-legged, which usually is not the case, you are a good candidate for this treatment. And again, the treatment can last for 12 to 15 years. So just the same as a bone, as a total knee arthroplasty. I'm going to look at a couple of the questions that were written down beforehand. This is related to protruding discs. They're touching the spinal cord. Would it be too late for regenerative medicine? Absolutely not. With platelet lysate, which is your platelets that have been concentrated, frozen, filtered, frozen, ruptured, and filtered. It's pure immediate release growth factor. It's great for nerves, but it's also great for herniated discs. So if the discs are not substantially protruding, we're going to attempt to stabilize your spine by injecting ligaments and joints in the back. If that's not enough, we can go into your disc and inject your disc itself to heal the disc from the inside out. Next question related to this: could regenerative medicine also be helpful after a spinal fusion? Absolutely. We can treat the fascia, which is the webbing network, at the level of the spinal fusion, and that can help with pain. And we can treat the level above and below the spinal fusion, which is often where pain is occurring. So spinal fusion is not a reason to not have treatment. I've treated people who have extensive cervical spine fusions, and they do surprisingly well when you treat the little area above the large fusion and the area below the large fusion, in addition to the fascia at the fusion level. So yes, the answer is we can help you with that. I'm going to look for a few more questions. It looks like there are more questions. So an 18-year, I guess, ago, car. Yeah, I can't see what that question is. Another question I'm looking at. So here, this is a long-winded question. What are the risks of hematoma on the lumbar spine for a PRP or stem cell procedure on a person on Xarelto treatment? We ask that you stop your Xarelto for 2 days. We've never had a hematoma as a result. We actually go to your physician and ask them to sign off on the 2 days coming off. If this is a 5-day treatment, will I not be taking Xarelto for that long? So lumbar spine is a single day treatment, so you're going to be off for 2 days before. Will stem cell therapy stop the degeneration of the disc and regrow some of the disc of the spine? So the answer is there's been nothing truly proven as it relates to regrowth of the disc of the spine. There is one study that suggested it, but other studies have not proven that stem cells will regrow disc material. It does make sense because the stem cells can become cartilage-producing cells called chondrocytes within the disc. And so you would think that they would regrow disc. But interestingly, platelet-rich plasma seems to also reduce the amount of degeneration within the disc itself. Will stem cell / platelet-rich plasma therapy stop ankylosing spondylolisthesis getting worse? So I'm not sure what we're talking about at this point. There's something called ankylosing spondylitis, which is an inflammatory condition, and PRP can help by stabilizing the spine, help that get from getting worse. How much is the estimated cost of PRP treatment from spinal stenosis, degenerative disc disease, and grade 1 spondylolisthesis compared with combined stem cell and PRP procedures? Again, for the spine, we are almost exclusively using platelet-rich plasma. We found that to be most effective. Very seldom do we use stem cell treatment. Occasionally, we will go into somebody's facet joints in the back after a failure with platelet-rich plasma. And likewise, we found that PRP treatment is as effective as stem cell treatment in the spine and safer. So we're going to do something that's safer as a result, if it's just as effective. Cost of spinal treatment starts around $2,000 and can work its way up to around $6,000 with one-day platelet-rich plasma. So your blood is drawn, and then 2 hours later, we inject you in multiple locations. And one of the things that I haven't talked about, we're very cognizant of your discomfort. We don't want you to be uncomfortable. We have we inject your back with lots of numbing agent. We have nitrous oxide sedation to help you get through treatment. And if necessary, and in very rare cases, we have intravenous conscious sedation. Leslie asks, I have bulging discs in my neck, shoulders, there's arthritis and back issues. I've had nerve blocks. I can't, sliding injections, acupuncture still hurting. So Leslie, it's worth your while to be evaluated by us because, as you know, the neck bone is connected to the shoulder bone, and sometimes you need to treat both. And when you treat people comprehensively, treating their joints, their ligaments, their tendons, their nerves, etc., you're going to get a better result than if you do a nerve block or something alone. So it really makes a lot of difference to do a concerted treatment effort, and the results are much better. Let's see if I can get to this question. I'm frozen again. There we go. I had PRP 3 weeks ago. I'm still having some pain in my biceps. I do like to exercise. Just wondering is if a person did anything wrong. I did no cardio. I did yoga, abs, and a little stretching. I want to get back to routine shortly, but when I don't want to ruin any platelets not setting in. So the answer is you're not going to ruin anything, but you gradually get back your range of motion and gradual strengthening over the course of time. We cut everybody loose at 3 months. Let's see what else. Catherine asked, she says, PRP and Regenexx works. Had Regenexx in 2017. Do you do other orthobiologic treatments? I've had Apex, done A2M. Regenexx has done both my knees, still perfect, and I'm bone on bone. Love Regenexx, doctor in Chicago, may be retiring. I'm in Ohio, not in the Cleveland area anymore. So we've done some A2M and had moderate results with it. We found that it worked fairly well in sites where there were significant fluid on the joint. But it had to be repeated, the fluid had to be drained, and A2M had to be done at least 3 times. I don't know what Apex is. There was something called IRAX, IRAP, interleukin receptor antagonist protein, which you may be talking about. And these are treatments that have been used by other folks, but the A2M has been used by Regenexx and seems to work, but is not as strong an answer for these things as some folks promote. Let me see what else. Is exercise and movement of the shoulder and tendon important after PRP for circulation? Not only for circulation, it's important for tendon healing of the shoulder, et cetera. So yes, we want you to be mobile. Typically and simplistically, if you're going into physical therapy, first comes movement, range of motion, either passively or active assisted or active range of motion. And once that's normalized to the extent that we can make it normal, then we're going to build your muscles back up again. So again, Catherine wants to get the point across that Regenexx worked on both her knees, and that there's not Regenexx in the Cleveland area. Yeah, you're going to have to come and visit us again, Catherine. We'll be happy to see you. So those are all the questions I have. I'm happy to entertain any more questions if you want me to take a few minutes. I think it's important to know that we are just so different than everyone else in the field. Hopefully my talk has enabled you to realize that, how comprehensively we treat, how skilled we are. You're getting the best physicians in the country who are doing this for you. I just want to get that across to you. There are a few more questions. and I will try to answer them. How long is the physical therapy after hip stem cell treatment? It's going to be at least a month. It may be more like 2 or 3 months, depending upon your condition, your limited range of motion, et cetera. So if you're not too bad, it's going to be basically a month. If you've got bad arthritis and a dead bone in your hip, with a limited range of motion, you're going to be involved in therapy for a longer period of time. So let's see. Carter said, please answer. I'm not sure. Carter, type your question again. I'm not sure what you want me to answer, what I didn't answer, but I'm happy to stay here and answer your question. Leslie asked, do you expect United Medicare Advantage PPOs to get involved? The answer is yes, at some point that's going to happen when enough of these self-insured employer programs are involved, then the next thing that's going to happen is the Medicare Advantage or the healthy portions of these insurance programs are going to get involved. The brokers that broker this to the employers are the same brokers that are brokering insurance programs to individuals. So sooner or later, this is going to happen. It's going to be a challenge because, again, it's going to be hard for the insurance company to differentiate somebody with high level of skill who's using image guidance and treating you comprehensively from somebody who's closing their eyes and sticking a needle with platelet-rich plasma in a joint. So I don't know how they're going to differentiate that. I'm trying to get to other questions. Aaron, if the physical therapy is on site, you set people up with a local PT if they're not from Pittsburgh. Yeah, we do know on-site therapy. We may show you some exercises, but we rely on your therapist. We give them a template, particularly if you've had the stem cell treatment, that they can follow loosely. But again, simplistically, range of motion before strengthening. And sometimes it helps to have swimming pool therapy where you're doing water walking. It's like walking on the moon, and your gait patterning will normalize more quickly as a result. So we are believers as physical medicine rehab doctors. We are believers in physical therapy even before we started regenerative treatment back in 2008. Carter says, I'm 22 years old, first year in dental school. I have a shoulder labral tear with biceps involvement. The grinding, popping, et cetera, drives me crazy. I don't have time for surgery. Can this help me? So the answer is absolutely yes. The question is how severe your labral tear is. So that's the issue. But we help labral tears, small labral tears with platelet-rich plasma, larger labral tears with stem cells. I would say overall we get good results. If you have a complete detached labrum, you're not a great candidate for us. We've done some of that and it's worked, but we really don't want to overpromise and underdeliver. But absolutely, labral tears are something we treat all the time with good results. So hope I answered your question. Leslie asks, I don't know what sliding injection on March 28th in McKeesport Hospital. I don't know what a sliding injection is. I'm sorry. But so I can't tell you whether I think it's worthwhile or not. If you got 13 years out of it, then I would do it again. But I don't know. I don't know what that is. So if you want to elaborate, I'll be glad to take the time to answer. So I think you are doing that. Steroid injection that they put you to sleep. So here's the deal. Steroids kill cartilage cells. So having said that, if the last one you did was in 2010 and you got 13 years of benefit from it, have at it. You know, it's a worthwhile thing. You're not going to spend crazy amounts of money out of your pocket. And if a simple steroid injection will work, then do it. If it doesn't work, we're around. We'll be happy to see you. But do understand that steroid is the evil steroid that it halts chondrocyte production in the joint, so you're not making cartilage, and steroids mess with your hormones and they mess with your bones. So in the long run, you're more likely to develop osteoporosis, osteopenia as a result of steroid injections, oral steroids, etc. Sometimes they're necessary, and it certainly seems like you're not abusing them. So I think you're okay. So Anonymous says, how long do you have to be off work after a hip stem cell treatment? The answer is, it depends upon how difficult your work is. So I had a fellow that I just did a very involved stem cell treatment in his hip, where I had to put stem cells into his dead bone, et cetera. He's 44 years old. And we tell people not to go back to work between the second and third stem cell treatment. And he did, and he will go to work tomorrow as well. So he's a good example of somebody who has a sedentary job. On the other hand, if you're a construction worker, it may be worthwhile for you to be off work for at least a month and maybe longer. So it depends upon what you do. So Leslie again writes, she's hurting a lot though, and she's had a lot of nerve blocks too. Well, I think then, you know, come in and see us. If you're having a steroid injection March 28th, you have to wait 6 weeks before we can inject your joint to make sure all the cortisone is off. If you want to avoid the cortisone shot, come in to see us. We're happy to see you and evaluate you, but it may give you some short-term relief. So that's fine too. So look, it's been great. You've answered, you've asked a lot of questions. Hopefully I've answered those questions well. I've appreciated all the questions that you've asked me, and I'll be happy to see you. My motivation is to get you better. I love doing what I do, and I'm going to keep on doing it as long as I can. So I get tremendous satisfaction from getting you improved, getting you back to doing what you want to do, what you love to do. So with that, have a great night. Thanks again. Really appreciate your hanging in there and hope to see you soon. So take care, everybody.